Brand name drugs can cost hundreds of dollars. Then a generic version of the same medication shows up, and suddenly the price drops to just a few dollars. So what changed? The biggest factor is patents. When a pharmaceutical company develops a new drug, it receives patent protection. That patent gives the company the exclusive right to manufacture and sell that medication for a number of years. During that time, no other companies are allowed to produce the same drug. Without competition, the manufacturer has much more control over pricing. That's the period when the drug is sold as a brand name medication. Eventually, those patents expire. Once that happens, other manufacturers are allowed to produce the same medication. Those versions are called generics. When generics enter the market, competition increases quickly. Multiple companies may start producing the same drug, and pharmacies can buy it from different suppliers. As more manufacturers enter the market, prices usually start to fall. Another reason generics cost less is that those companies didn't have to invent the drug. The original manufacturer already spent years developing the medication and running clinical trials to prove it works and is safe. Generic manufacturers still have to meet strict FDA standards, but they don't have to repeat that entire development process. That lowers the cost of bringing the drug to market. Generics also don't require the same level of marketing. Brand name drugs are often supported by advertising, physician outreach, and large sales teams. Generic drugs are usually prescribed simply because they're available and cost less. That means far lower marketing expenses. Even though they're cheaper, generics still have to meet strict regulatory requirements. The FDA requires that generic drugs have the same active ingredient, the same strength, and the same therapeutic effect as the brand name version. They're designed to work the same way in the body. So when you see a big difference between the price of a brand drug and a generic version, it usually comes down to two things: patent protection and multiple manufacturers competing to sell the same medication. That combination is what drives prices down. In future videos, we'll keep breaking down other confusing parts of pharmacy and healthcare, one piece at a time.